Hi, Mrs. Hombo. It's good to see you.
Hello, Doctor. How are you? It's good to see you also.
I'm good, thank you. Now, I asked you here today so we could talk about your cholesterol.
Mm-hmm.
Okay? Now, I'm glad to hear that you've been working on your diet and exercise. That's great. You should continue to do that.
Mm-hmm.
Okay? Unfortunately, the cholesterol is still quite high.
Oh.
Your total cholesterol is 285,
Mm-hmm.
and your LDL cholesterol, which is the bad cholesterol, is still greater than 200. Your goal is less than 100.
Mm-hmm.
And the reason we'd like to keep you below that level is because you have several risk factors.
Mm-hmm.
Okay? The first is that you're a woman over 55, and that increases your risk of heart disease. Okay? Second is that your dad had heart trouble in his early 50s, and so that also increases your risk. And finally, because you have high blood pressure and you smoke, that also adds on and increases your risk of developing heart disease. Okay. Now, when I put all that information into a special formula, it turns out that over the next 10 years, you have a 20% chance of developing heart disease. Now, when you think about it, that means 1 out of 5 patients like you will go on to develop a stroke or a heart attack.
Mm. Boy, that really sounds pretty serious.
Well, only if we don't effectively lower your cholesterol and therefore lower your risk of these complications.
Mm-hmm.
Now, I know you've been having a lot of trouble with the smoking. That's one of the things that you can do on your own to effectively lower your risk. Okay?
I know. I know.
Well, let's continue to discuss that next visit, okay?
Mm-hmm.
Now, as for your cholesterol, I'd like you to help me decide what would be the best medication for you.
Well, this medication, is this something I have to take, say, the rest of my life?
Yes, to most effectively prevent the long-term complications of high cholesterol, like stroke and heart attack, you'll need to take it every day.
Mm.
Okay? Now, why don't I go on and describe the 3 possible medications?
Okay.
Okay? Now, the first one is a drug called a statin. The name is atorvastatin or Lipitor. There are a lot of medications out there, but this class of drugs, the statin, has been shown to be most effective for lowering cholesterol. It can decrease it 50 to 60% in some cases.
Mm-hmm.
Now, there are a few side effects, but these are quite rare. They develop in only less than 1% of cases. Okay. Now, the first is liver trouble. You can develop hepatitis or inflammation of the liver. That's something that we can monitor with simple blood tests. So we would check your blood work now at baseline before you start the medication, and then again in about 6 weeks after you've been on it for a while. And then we check it periodically just to make sure you're not silently developing any liver problems. The other thing you can do is watch for signs of liver trouble, like jaundice or yellowing of the skin, itchy skin, and also pain in the right side of your abdomen.
Mm-hmm.
Okay? The other side effect of the medication is muscle problems. Now, this is something that you'd have to let me know if you start to develop pain or weakness in your muscles. Okay? This happens most frequently when you're on other medications. So we would have to keep it in mind in the future should we need to start you on any other medications.
Mm-hmm. Well, what are the other options?
Okay. The second option is a drug called cholesterol. People find this cumbersome because you have to take it several times a day. And it also has a bothersome side effect of constipation.
Mm-hmm.
The third option is a vitamin called niacin.
Mm-hmm.
Now, taken at high doses, it has been shown to effectively lower cholesterol. But again, this has some bothersome side effects. When you first start the drug, you can get flushing and increased heart rate, things that really scare people and bother them.
Mm-hmm.
Okay? So given all that information, what do you think?
Well, that is a lot of information. And I hate taking medications. And, I don't like the sound of the side effects, but I don't want to have a heart attack like my father.
Right.
But based on the information you've given me, I think I would prefer to take the statin since I only have to take it once a day.
Mm-hmm.
But can this medication really prevent having heart attacks?
Yes, absolutely. There's been very good research that shows that statin drugs can effectively prevent first-time heart attacks in people just like you. Now, do you have any other questions?
No, I can't think of anything right now. I guess I know what it means, what I have to do.
Okay. I've given you a lot of information, and I could see how this could be very overwhelming. So if you come up with any questions, let me know, okay? I have this handout here that might be helpful in the future. Okay, you can refer to that and remember the things that we talked about today.
All right.
Okay.
Okay.
All right, so why don't I review the plan with you, and we'll see how it sounds. So we'll get your blood work drawn today to check the liver, and then we'll have you take the prescription to the pharmacy, and then you'll start the medication tonight with dinner, because that's the best time to take it, is with dinner.
Okay.
And then I'll have you come back in about 6 weeks, and we'll recheck the blood work, and we'll see how everything's going.
All right. Okay.